You are at suicide prevention within a multi-tiered system of support, part one. I'd like to introduce Kelly Perales. She is the co-director of Midwest PBIS. And I'm going to read just a little bit. It's already on her slide, but I'm going to read just a little bit about Kelly. She's a licensed clinical social worker. Kelly has worked for both a school and community employer as a clinician and administrator. I hope I said that right. And she's worked as the center of, she's been a part of PBIS. We appreciate her patience with us, and we hope that you, if you have any questions, be sure to ask them, and then we'll take questions also from our webinar. So thank you again.
Thank you, everyone. It actually gave me a chance, this being my first time out of the Eastern time zone in a very long time, to have a little snack while we were waiting. So any way we can spin things in a positive way, I think is helpful. And because we're going to be talking about a topic today that can stir up some feelings and emotions in all of us, I want to start with something that is a strategy to help our brains with protective factors and also to grow our resilience. It's November. This is a time for giving thanks and being thankful. And one way that we can help ourselves feel resilient and improve those protective factors is expressing gratitude to others. So what I'd like to encourage all of you to do is to just take a minute and send a text message or an email to anyone that pops into your mind. Could be a family member, a colleague, a coworker, anyone that comes to your mind. I'm just going to pause for a moment, and you can do this whether you're here in this room or joining us virtually. Take a minute to express gratitude to someone else. Mine, of course, goes to the tech crew here today, but I don't have their numbers, so I'm not going to text them. I want to give some acknowledgements to colleagues of mine who we've been coalescing around this topic and this work for several years now. It is something that, there's strategies and recommendations I'm going to share with you today, as well as examples that have been cultivated over our time working together. And I've had the privilege of presenting with these colleagues in other settings. In fact, last week, some of you may know, we had our annual PBIS Leadership Forum. It was virtual for everyone who attended. And Eric Bruns and Jennifer Stuber this year from the University of Washington helped me give the talk with some examples that they've been working on out in the Northwest. Situating suicide prevention within a multi-tiered system of support is really the way in which we as educators and mental health providers can come together and think about all the things that you heard Dr. Bradley speak about this morning. What is our local context? What data do we have at our fingertips that can help us with decision making? How do we select evidence-based practices and develop a continuum of prevention through, in this instance, postvention that is going to be at the ready to be responsive to the identified need? One of the #1 reasons why this topic is being talked about more and more, which I certainly appreciate that we're discussing it, because that helps us with reducing stigma, and I'll touch on that here in a little bit. It continues to be the second leading cause of death among young people. And I'm going to say a decade or more ago, it was #4. So this is data that is not trending in the right direction. And we have yet to uncover what the impact of these last 19 months are going to be on this data point. As professionals, we all want to create safe, consistent, nurturing environments for the topic at hand today and tomorrow: social, emotional, behavioral, mental health, and wellness. And certainly as a professional, as you heard Janet introduce me, this has been a passion of mine. How can we eliminate non-academic barriers to learning? How can we connect with those children, youth, students who are our most vulnerable population? How can we identify especially mental health need and connect kids to the services that they need? I also want to tell you a couple of things about me personally that have made me even more passionate about this topic in recent years. The first is that I have 4 children who fall into the age range of that data point. And so frankly, that's terrifying to me. As my teenagers transition into young adults during a global pandemic, what that has meant for us as a family. I also want to tell you that in February of 2020, my kids lost a friend to suicide. And that was a new challenge for us as a community and a family. And then finally, I can't even look at these pictures. This is Michael Kelly. He is a leader, was a leader and champion in school social work and school mental health. He worked at the Loyola University in Chicago. And on September 2nd, he took his own life. If you want to read more about Michael's story with depression throughout his lifetime, there is a link in the PowerPoint that you can access, written in his own words. And if you can't get it that way, you can email me. My email's in the PowerPoint as well, and I'm happy to send it to you. And so these are some additional reasons why I feel like we need to talk more about this topic, and that piece about not only what we can do for our youth, but what we can do for each other. And so with that, I think we need to have some expectations for taking care of ourselves and each other. This topic is one that unfortunately needs to come with a bit of what's referred to as a trigger warning, where if something about what I'm going to share with you makes you feel uncomfortable or on the verge of tears like myself, please do what you need to do. If that's step out of the room or again, text a friend or colleague, please do that today. Oops. And also, of course, there are resources. Even in preparing my slides, I was Googling something that I couldn't remember the name of, and it had to do with suicide. And to my pleasant surprise, when you Google anything with the word suicide in it, the first thing that pops up is the crisis hotline, in case it's a person who is maybe exploring ways in which to end their own life, or is feeling sad or depressed or having thoughts. And, so certainly resources are at our fingertips, which is one of the great things about technology these days. And so certainly if you're worried about a colleague, a friend, a loved one, please reach out and get help. Please reach out and check on them. We need to be checking on each other, especially because I don't know about you, but I've been working out of a home office this entire time. In fact, like many, this is the first time I've put on big girl pants in a really long time. And in fact, I had to dust them off literally when I grabbed them out of the closet. So there's that. Okay, so today, never been more clear. And to me, this is the silver lining in this last 19 months, is that finally, these topics that we care about are getting more attention. They're being prioritized up to the federal level with dollars. And that's really great news. Dollars enough are not going to be sufficient, right? People enough are not going to be sufficient, although there aren't enough of them to go around these days. I wouldn't certainly argue with that. And so we have to think about the ways we can systematically manage anxiety, depression, and the impact of trauma. We have to focus on our systems, the adults in our systems. You heard that message this morning. Data and science do matter. And so, when, again, in the community where I live, which it's not in this state, other individuals have taken their own life and people put things in the newspaper that sort of dismiss it or make it seem like it was not a suicide. That's not helpful to us overall. And so we've got to pay attention to the numbers and the data. We need to be thinking about, as again, Dr. Bradley said, people and relationships above all, prevention, early identification, and intervention at the first sign of risk. So these next couple of slides, again, this is data that comes in that new document. I also have a slide in here that will give you a link to this resource that, I think the good news here is that our work is being endorsed and promoted across the country. And it gives all of you an opportunity to build on the really great things that you're already doing. Nevertheless, if you look at this data, this is all pre-pandemic. And so again, what we do know is the research tells us from prior major catastrophes, disasters, and life events is that, we're kind of at the tip of the iceberg here. And this data is probably going to get worse before it gets better. And so although I've been hearing things like teachers are end of the school year exhausted and it's only middle of October, right? How are we going to wrap our arms around what's happening right now and move forward together? And so the good news is that, people are acknowledging that this is a crisis. We're in a mental health crisis. Now we have to think about, and what are we going to do about it? All right. So again, just to orient us to some sort of a definition about mental health and wellness. This one comes from some of my colleagues in Florida who over the years, and they had some federal funding also through Project Aware, they really emphasize this idea that what we want to do is reduce or have low levels of problems and higher levels of competencies. So again, what are the ways in which we can build on protective factors and resilience and skill sets and reduce risk, reduce some of the types of challenges that people are having in our communities, right? And so here's that document from the US Department of Education. It's very exciting. I feel super proud to have even a small connection to this that was vetted all the way up through our federal administration. And you heard a lot more detail about these recommendations, but I encourage you to check it out. Certainly, this idea of multi-tiered systems of support is critical. What we've learned in recent literature is that no matter what type of program, practice, initiative that you have taken on in your district or school, we have to embed it into our multi-tiered system of support in order for it to stick and sustain, in order to be able to use data for decision-making. And really, what we're finding is that we can do all of the professional development that we are able to do. That in and of itself is insufficient. We've got to follow up any training with ongoing coaching and technical assistance, and making sure that whatever we provided training on is able to translate into our practice. And so whether you're talking about addressing substance misuse or trauma-informed practices or teaching social emotional competencies, there are guidance documents available. These are short, practitioner-friendly guides with strategies and examples that will help you think about how to use the core features of a multi-tiered system of support to do your work. And today we're specifically going to talk about that in regards to suicide prevention, intervention, and postvention. This graphic comes from Kent McIntosh and Steve Goodman's book that they wrote on aligning and integrating academics and behavior. But what you see in the center are essentially those core features of a multi-tiered system of support. The reason we use the core features from PBIS is because we have 24 years of data and evidence to tell us why it is the multi-tiered system of support that leads to improved outcomes for kids and adults within schools. And so this is why we are leveraging those features to think about what we do to address suicide. A couple of things for your consideration here before we get into the nuts and bolts of the logic of a multi-tiered system approach. Suicide happens when physical or emotional pain exceeds hope. Those of us in the room who aren't in a place of pain and suffering, feeling depressed, anxious, or isolated, feeling impact from trauma, we can't wrap our brains around what brings someone to taking their own life. And frankly, it doesn't matter how much we think about it or try to figure it out or what we could have done or said to prevent it. Once someone has decided that the only way out is what they perceive to be less painful than their own life, it's going to be hard for any of us to do anything about that. People do not want to die by suicide. They just want their pain to end. 1 in 5 of us during our lifetime, based on the current data trends, are likely to experience suicide within our own family. And while we don't want to overpathologize young people especially, there are unique risk factors associated with school-age youth to consider. Think about it. Impulsivity, risk-taking behavior, peer group influence, PS, how much time are our kids spending on social media right now and the internet, and limitations in understanding the permanency of suicide. And so that is why, although suicide affects people of all ages, it's really important for us to pay attention to what's happening for our young people. So here's some more statistics for you. This comes from the Center for Disease Control. I'm not going to go through each one of these item by item. But what's important for us to think about is what are the ways in which we can have a call to action. And it turns out we need to act at every level. Again, what can we do now for prevention? What can we do for early intervention to reduce risk? What can we do when maybe kids are considering suicide, and what we need to do if they're returning from, let's say, hospitalization or something like that? And then what is our plan when someone in our community dies by suicide? Because if we don't have a plan, then we are missing the mark, because it will happen and we need to be able to respond in a way that's helpful and supportive. So let's talk a little bit about prevention. Couple of things to consider. And by the way, I encourage all of you to ask questions as they come to your mind rather than waiting till the end. And Janet's going to let us know if there are questions coming in through our virtual participants. I'm also going to tell you, I don't have all the answers. And for those of you who might be wondering, just tell me the one thing, the one program, the one curriculum, the one intervention. I feel very strongly that that is not my role. I want to guide you to consider what the options are, and I want you to go back to your system with your team and have a process to select what's going to work in your community. I don't live in your community. I don't live in your state. And so I feel like it's not for me to say, if you just do this and that and the other thing, that's all you need to do. And so I'm going to show you some examples, and I'm not going to go into detail about necessarily any of the package things in particular, because I feel like it's more important that you have a process to examine and select what's going to work best in your situation. So let's talk a little bit about supporting. SEBH is what you call it here. I think context is important. I don't necessarily care what terms anybody uses as long as we're focusing on the system, the data, the practices, and using those core features. Certainly, we need professional development for all. You heard mental health literacy as a recommendation already this morning. That's true for our professionals, and it's also true for our families. And in my mind, this connects to especially stigma and what families and communities' beliefs are about mental health, about talking about suicide. There are some religious aspects to taboos around that as a behavior. And so it's really important to help get a shared understanding and equip not only staff working in your schools, but also families and community members. In addition to mental health literacy, deliberately teaching coping skills, problem-solving skills, and help seeking are really important strategies to help us with prevention. There are gatekeeper trainings that are available for teachers. There's some virtual simulated ones, as well as other kind of in-person type events. And there are multiple school-wide initiatives that can increase protective factors and reduce risk factors. Use your local data. All right, so I think that it's true here in Iowa that you all use some sort of youth survey, whether that's the YRBS or some other Iowa version. There's a version in my state that we use. I live in Pennsylvania. It's called the Pennsylvania Youth Survey, right? We all have our own little slant on things because context is important, right? Let's help you think about how to use that data. Universal screening. This might be something you already have happening in your district for social, emotional, behavioral, and mental health needs. And if it's not, you have to think about the right time to start something like that. It's a process. It requires lots of decision-making by district leaders. And what I've learned from my colleagues who do research in this field, maybe right now, while we're still in this time of crisis on the daily basis, it might not be the time to start something new, right? But certainly something to consider as part of gathering data to help schools. Other types of school data. And grades. What about kids who instructional environment? They ask to go to the nurse. They have somatic complaints, headaches, stomach aches. Some schools don't have nurses, so maybe they just show up down at the office, or they ask to see the school counselor, social worker, psychologist. They're still missing class. And so how do we start to get our arms around who's leaving class? What's the frequency, intensity, severity, and duration of what might be internalizing issues, right? Anxiety and depression don't always show up as acting out problem behavior or even crying. And so we've got to try to uncover the need by looking at new data points, and that includes other community data points. What do you know about what's happening for kids and families in your local school community? Here are a few different types of these curriculum or programs that are available to address mental health literacy, and gatekeeper training. And so again, I encourage you to check out the slides. They should be on the, I can't remember the platform. Thank you, for you to look at. And again, what I would encourage you to do is investigate these available options and see if it's even something that would work for you in your situation. You know, it's not required that you add one more thing, especially right now. You need to first examine what are we already doing and what's working. All right, so signs of suicide, gatekeeper training, and depression screening. Again, thinking about what curriculum do you already use? Do you have health class? Do you have a time where you're teaching coping skills and pro-social skills and problem-solving skills for kids? Sources of strength is another one, using peer leaders, which also enhances protective factors. And here is a suicide prevention guide. This one actually was developed in Pennsylvania. And so, you know, there's lots of these types of resources out there that give you other ideas about prevention and early intervention, as well as things you can do like media campaigns and et cetera. Is there a question out there? Yeah. Go ahead. Okay, I have to repeat the question. The question is, are any of those curriculum focused on elementary schools? Yes, and so this is in the session this afternoon. Again, use a process like you would if you were looking for reading curriculum to say what's available for our target population and what's going to fit best with what we're already doing in our schools. So yes, there are some that are specifically geared towards elementary as well as secondary. Great question. All right, so here is, I'm required by law to show you at least one triangle. That's not really true. I'm just teasing. That shows essentially what a multi-tiered approach might look like. All right, and so you can see here some of the things I've been touching on with thinking about prevention. And again, what are you already doing? And here's what I worry about. What I worry about is too many initiatives, programs, practices, teams, committees, work groups that are doing lots of different really great things, and it's all separate and apart, and therefore you're not maximizing your impact, right? So that's things like SEL, and we meet on Monday, and trauma-informed care meets on Tuesday, and bullying prevention on Wednesday, and on Thursday we have the blah, blah, blah. You know, there's lots of them out there. And we don't do this on purpose to cause ourselves more stress and strain. It's because we have to it. Something comes down from the State Department, the feds, that's meant to say, we've got a problem to address here. And we hop to it in districts and schools. And we say, we've got to have something for suicide prevention. And it says we better have a team and a plan and a this and a that. And probably you made one around returning to school or recovery, right? And what happens all too often is the same people are on way too many work groups, task force committees, and we need to find opportunities to align and integrate and do a few things really, really well. And that's going to help us with all of our SEBH, okay? And so think about the ways in which you're already creating safe, predictable, consistent, nurturing environments. Think about the strategies and the practices that you already have in place across your continuum. And then after you look at your data, decide if you have gaps, and then use your process for selecting something new. All right. And we're going to talk about some things at sort of the targeted intensive or tier 2 or tier 3 here in just a little bit. But again, the big idea is, what are the strategies to support students at risk? And that includes, what other things do we need to equip adults with who are going to be responding to those students who are indicating that they're at risk or have additional need. Then we need some interventions that we can put in place. And by the way, tier 2 is the hardest. We know what to do oftentimes when kids are struggling kind of in that individual realm, right? Now, we're trying to move away from let's just connect them to an adult, right? The adult is not the intervention, right? So we've got to be saying, what are the best practices to address the needs? And then those who are most at risk, how are we going to support students who are contemplating suicide, attempting suicide, who need to be hospitalized to keep them safe? How do we help them transition back to school? And what do we do if a young person in your community dies by suicide? So here is, and this was to the question earlier, one option to help your district select some sort of intervention, whether that's on the prevention side or all the way along your continuum. This is the Hexagon tool. It comes from NERN, the National Implementation Research Network. I know that there are schools and districts who use this for every decision they make. Again, whether that's the reading curriculum, a universal screener for SEB, or a curriculum to help address suicide prevention. And it really helps you stop and think through, how are we not only going to pick something that we think matches our need, but also put it in place in a sustainable way, right? We don't need to buy the shiny new object right now and feel really good that we made a great purchase. And then in a few months, that's over there collecting dust on a shelf, right? And so thinking about some of the programs and practices, again, big idea is, what are we going to do for all? Kids, staff, families, caregivers, and community members. How are we going to work together to make sure that we are not only bolstering what we're doing for prevention, but also jumping in at the first sign of need to mitigate risk? And right now, it might feel like there's lots of risk. I was talking with some coaches in a district in another state, and they have a lot of students right now, and you might feel this way too, who are having trouble with emotional regulation. And so what they were doing at the start of the year was saying, okay, we'll get those kids out of the classroom and plunk them into different places where they can, get themselves together and, get back to class. And I said, well, let's start to track that, right? Like, how many kids? Is it the same group of kids? Is it a lot of kids? Is it happening for 5? We're meeting virtually, and I said, so you've got 400 kids in that school. How many? Later says that's everybody, right? What are we doing to address that in the classroom, so that when we have dysregulation, there are strategies that kids can learn to use without prompting, or in the short term can be prompted to use, right? Couple of things about the evidence base on suicide prevention programming, and there's lots of references in here, but notice that we need to emphasize work that's driven by adults. A lot of these programs are not culturally adapted, so you have to think about how you're going to address needs in diverse communities. And they're rarely grounded in theory, so it's really important that there's a comprehensive approach to suicide prevention, aka your multi-tiered system of support, and that you're using universal screening. All right, so the thing about data is, and by the way, the thing about the evidence base, it's continually building, right? This is true in our mental health world as well. Evidence-based interventions for mental health have been building in recent years. And there's lots of really great stuff emerging. And there's this notion of kernels, which is like the salient pieces of evidence-based practices. Like if you look at all the evidence-based practices for anxiety, there are some nuggets in there that we can use and get some desired effect, right? And so that's how the literature builds. Even our work that we're doing in, call it MTSS, PBIS, Interconnected Systems Framework, the literature continues to build on what we know works, right? And then we have this research to practice and practice to research back and forth as we make it happen in the real world, right? In your communities. And so that's why the literature around this is still building. And when we look at data, like universal screening, we want to use it with other data. So we don't use it in isolation. And so it's really important to kind of think about all of that in context. So what kind of other data should we be considering? Again, I mentioned some of the data points that schools typically look at. Now, if we're thinking about any time a student leaves the instructional environment or universal screening, as well as perception data. Are you surveying families? Are you surveying teachers? Are you surveying students? To ask for their input on what they believe from their perspective is happening. And then your community demographics. And this may have changed in the last year and a half. For some kids and families, the pandemic was maybe a blessing in disguise. For others, it has been a very big crisis that continues. People lost employment, people lost loved ones. That continues to happen right now, today. And so what does that mean for the kids and families in your community? If you want to read more about universal screening, this is a great guidance document. The reference is there. You can find it for free online. And it gives you kind of a step-by-step approach, so to speak, with how to select and implement a universal screener. And some of the big nuggets for you to think about with regards to suicide prevention is how do you use that with other data to help inform your decision-making. And what you can see here, this is an elementary example where they triangulated their screening data with other data, as well as what they knew about kids who were already connected to intervention, because here's what we're learning. People sometimes worry, if we do a screener, we're going to uncover kids. Yeah, you are. But you know what? Most of those kids you already know. And you already have a lot of them connected to intervention. Usually the kids that you have pop up as at risk who weren't already on your radar, they would benefit from a tier 2, low level, low intense intervention. So it's not necessarily true that every kid who screens at risk on a universal screener needs an individualized intensive intervention, all right? And so that's why it's important to consider all of the factors you have available. This one here comes from a middle school. This is a school that continued their universal screening last year when many kids were virtual in their learning. And lo and behold, they used student self-report because teachers felt like they couldn't accurately report on the screeners when, they hadn't even seen a kid without a mask on, or kids were only joining virtually and maybe didn't have their cameras on. But guess what kids said? 40% of middle schoolers in this school said they felt socially isolated. Well, duh, right? They're adolescents. And so here's the other thing. Sometimes our screening data is going to tell us we need to do something more for all. Right? And so in this school, they created an action plan to address some things at tier 1. And so they did things like helping kids find ways to connect with other kids, especially if they were virtual, also to make more connections with adults within the school. They did have some, other things along their continuum that they did for kids who had additional need. And in this particular example, this universal screener has a direct question about risk of suicide. And for kids who screen positively on that one item, it's called question 24, which is, I've been thinking about harming myself. They did a follow-up assessment, right? So that's kind of a gated approach to determining risk for suicide, all right? This is just one of many universal screeners. I gave you a different example in the elementary one. So, again, I'm not necessarily endorsing any particular instrument. You've got to find what might work for you. So let's talk about some strategies at tier 1. Again, I've mentioned some of them around professional development and things like that, universal screening, etc. Look at some of the other practices. It might sound familiar because it comes from positive behavior intervention and supports. But what we are finding is, again, now more than ever, we've got to get back to the basics. We've got to reteach kids, especially if you were virtual for any period of time last year, how we operate inside of schools. And for your kindergartners and maybe first graders, or any kids who are in a transition year, starting middle school, starting high school. My youngest started 10th grade this year. He was virtual all of last year. So this was his first time going into school. We did go in and do a little, walkthrough of his schedule before school started. But the first day of school, he came home and said to my other son, "Where's the library in the school? I couldn't find it." And I thought, oh, duh, I didn't even think about that when we were there, right? And so what are the ways that we are being deliberate about how we set up our system of school, being clear about expectations? And that includes things like mask wearing and how kids are when they're having their lunch and protocols and things like that, but also all of the other stuff. We've got to reconnect with kids and kind of get to know them again. And so it's really important that we think about rapport and how we're giving feedback to kids, both positively and when we need to correct errors. All right. Couple more things here about addressing stigma and implicit bias. These are really critical when we're talking about what we're going to do for all. So I already mentioned, what are the perceptions of families within your school community? I have heard still in some places that families think things like SEL should not be taught at school. I don't want to say how old I am, but my very first job as a school social worker over 2 decades ago, I used to go in and do like social skill lessons in classrooms, and I had a mom come and pull her kid out into the hallway while I did that. I'll never forget it. She thought that I was teaching values and that was to be done at home. And I just heard that recently last week. Not in Iowa, so maybe that's not something y'all deal with here. However, it's a thing. And so how do we help parents understand that just like we want their children to learn how to do math and learn about geography, we need them to learn coping skills and problem-solving strategies so that they can be good functioning adults. Right? Productive citizens in their community. And that's something that we want to work on together. So how do we partner with families and help them understand what we're teaching and how they can work together with us on it? In some communities, people believe that mental health only happens to certain groups of people. People in certain social economic status. People in certain communities of color or minority. And in fact, what we know is the prevalence of anxiety and depression, and I'll stick with just kids here, is the same as the prevalence of the most common physical health issues, which are asthma, diabetes, and obesity. And yet, until very recently, we haven't been paying enough attention to anxiety, depression, and the impact of trauma. And again, for some, talking about suicide is taboo. And so we've got to break through those stigmas, the misinformation, and find ways to partner with families and community members to reduce stigma and also implicit bias. And that is why we need to teach everyone, including our families, about this important topic. We have to work to, and I don't like this word, normalize this topic so we can speak about it freely, which will help us with prevention and intervention. And then as adults, we have to learn to model. It's okay if it makes us uncomfortable, this topic. It's okay if it stirs up feelings of sadness. It's okay if we don't always have it all figured out. So let's encourage teachers to not stand up in front of their students and feel like they have to pretend to be perfect. I remember when one of my kids was in preschool and we saw his preschool teacher at the grocery store. He was like pretty much in his head, and he said out loud, like, I thought you lived in that little schoolroom, right? Like, he's 4 years old, he doesn't know. But kids think their teachers are like up on this pedestal. And so how do we model that some days we're going to struggle and we're going to have problems at home, or we broke a glass or are having an argument with our own family member or whatever, right? How can we model coping skills by saying things like, I'm feeling really frustrated right now, and I'm just going to take a minute before we move on. And then help kids practice those strategies in the classroom. Finally, to this point, we want to make sure that we have family and community members as part of our work. Invite them to the table on your teams. There's this notion in our schools that we've got to figure it all out before we bring in families because we don't want to air our dirty laundry or things like that. We're never going to have it all figured out. And so let's be vulnerable and open and hear from those in our community who are impacted by what we do and the decisions we make, and have them be part of our work and our plan. Let's look at some examples. There are lots of these available for you online. I encourage you to take a look. If this doesn't work for you in your schools, in other words, you're not necessarily implementing PBIS, that's okay. The point here is to say, what are the ways in which you can teach coping skills, which is what you see over here on the far right, and practice and model and speak freely about them, right? And so in this example, highlighted in blue, and I know that's really tiny writing, are the ways in which those skills are part of what everybody does all over in this particular school. Here's another one. This is in the classroom. This is a classroom list of expectations. What do we do when we come into the classroom during group work, if we're working online, or when you feel upset? These are the ways in which you can be respectful, organized and achieving, and responsible when you feel upset. And also during transitions, right? So let's name it, teach it, practice it, and give both behavior-specific praise and also error correction, or prompts or pre-corrects, right? Let's talk about tier 2. Again, there are a list of some targeted interventions. This is not all inclusive, nor necessarily the ones that I would say you must do. It is simply some examples for you to consider, right? And so you can see here, check and connect, that's more for the secondary level. Check in, check out, that's an evidence-based practice that does not take a lot of resources. You need very few adults to be highly impactful for lots of kids. And it's all about additional interaction and connection and relationship with adults, right? Things like mentor programs, peer buddy systems, behavior contracts, additional suicide risk assessments. We have to be thinking about those as targeted interventions as well. And mental health treatment programs. And there's some that are listed there. Things like CBITS, cognitive behavior intervention for trauma in schools. And there are some other trauma-informed targeted interventions that are listed there. Again, I want to just sort of sidebar here and say, what I really want to encourage you to do is not go back and say, ooh, I heard about CBITS at a conference and we should do that. What I want you to do is say, uh-oh, our data says maybe we need to add in a tier 2 intervention. Let's explore which option is going to be best for us, right? That's what I want you to take away from this slide. The other thing is you're going to have to decide with some sort of a flow chart, what type of intervention do we need? Is it reteaching coping skills from our matrix that you saw in that example from a minute ago to a targeted group of kids? Or do we know we have a group of kids who are really struggling with anxiety and we'd be better off choosing an evidence-based practice that deliberately addresses anxiety in kids, right? So your teams are going to have to practice and get more slick at deciding what's going to work best where, all right? So there are some curriculum considerations. And again, you don't have to buy one. Maybe you've already established your expectations. And again, tier 2 is a higher dose of tier 1. We're layering on extra support. Think about math and reading. That's what you do if kids aren't responding to the general curriculum. You layer on additional support. They still get the regular curriculum, and then they get an extra dose of instruction in that area. That's what we want to do when we're talking about pro-social skills, coping skills, and problem-solving skills, right? And so, again, I already talked about this, not here to endorse any intervention. It's not like they say, please talk about this one. But what we know is it's highly effective, highly efficient, and it's all about more interaction and interface with adults, which is a huge protective factor for kids, okay? Tier 1 at a higher dose. If you have a continuum of interventions, keep in mind, you don't need to have 17 things you're doing at tier 2. 2 or 3 is sufficient, right? We don't need to be a mile wide and an inch deep, not only with our different types of initiatives, but also with our practices. This is the time to focus and do a few things really well. And by the way, if you're talking about low-level basic interventions, whether that's check-in, check-out, or reteaching social skills to a handful of kids, you don't have to have someone who's clinically trained to facilitate that intervention. Any adult who has a positive attitude, is always at school, and likes young people can facilitate some of these interventions, right? It's the other end of the continuum where it's things like CBITS that I mentioned, or another evidence-based practice that requires training in that intervention, and also the ability to deliver it within a school setting. There are some mental health and clinical interventions that we shouldn't be doing in school because the clinician might be meeting with the kid during second period or at 10 in the morning and then saying, okay, thanks for talking with me about all of that really crappy stuff that's happened at home. Off you go to class, right? There's a time and a place. So there are some really great options for mental health and clinical interventions to be facilitated in schools, because again, kids are there. It's a great way to have them access intervention that they might not have the opportunity to do so outside of school. And yet we've got to have the right people positioned to facilitate those interventions and then be part of the planning for progress monitoring and decision-making with the school team. Tier 3. So here, not only are we talking about intensive individual intervention, which generally involves a whole team of people wrapped around one young person, but it's also about when we need to hospitalize a young person to keep them safe and how we help them return to their home and school after hospitalization, all right? And so there are some considerations for reentry procedures and policies. Again, you have to think about what's going to work for you and how you can partner with your community providers. And I recognize that sometimes in rural areas, it might mean that treatment, residential treatment or hospitalization might not be close to home. And so what are the ways that you can coordinate care and coordinate reentry? And so you can see here, it's really important that we have everybody on the same page and part of the same team. Family members and caregivers, teachers and other adults in our schools, and mental health providers, as well as natural supports. Please note, and this one I am going to read, there should never be punitive measures or policies that can increase stigma or reduce help-seeking behavior in the reentry process. All right, so we've got to do what we can to foster care and connection, help kids feel safe, and help them to navigate what's going to feel like an uncomfortable situation. Because I will tell you, and again, I experienced this for my own kids, even if we're trying to protect the confidentiality of the young people who are dealing with these issues, the kids know. They know about, and will come home from school and tell you, kids who have overdosed on drugs and alcohol, kids who've tried to harm themselves and are hospitalized, kids who've taken their own life. They know before any of us know. And so how do we help kids who are trying to re-enter school when everybody kind of knows their business, right? So there are some examples and strategies that you might draw from to help establish re-entry procedures in your school and community. And I encourage you to check those out, as well as some of the other resources available to help you navigate planning for this and planning for postvention. And again, the more you can get ahead of this, as uncomfortable as it can be, the better off you're going to be when it happens, right? Just for those of you in the room, by show of hands, have you had a death by suicide in your school community? Yeah, look around the room, right? That follows the statistics, right? Okay. So lots of resources. I put a link to one. This is out of the University of Pittsburgh at the STAR Center, a really great manual around developing postvention procedures. I'd really encourage you to check that out and keep in mind that, this is a crisis. And so that is why it's really important to follow that mantra. If you can predict it, you can prevent it. So yes, we want to prevent suicide. And since chances are it's going to happen, we should have a plan for how to deal with the crisis. So you're not trying to figure that out in the moment. Okay. It's also important to consider contagion. I know people get nervous about this because it's scary and uncomfortable, but it is important to think about other kids who are vulnerable and how we especially connect with them after a suicide in a school district in the event that they might be considering following suit, so to speak. All right, so is your school's suicide prevention planning and implementation aligned with your multi-tiered system of support, comprehensive across your continuum, student and school centered, adult or student directed, and data informed? Those are the kinds of questions that you want to ask yourselves as you create your own plan. I'm realizing the time. I think I'm 3 minutes between you and lunch. So I'm going to give you a super quick example, and then I'm happy to answer some questions and we'll wrap it up. This one comes from a district in Pennsylvania, and I'm just going to share it with you. It's one I'm familiar with. There are lots of great stories out there about districts and schools who are doing this work really well. If you are interested, the session from last week, which highlighted some work out in the state of Washington, you could listen to that recording and hear some more about other examples. Here is some data about this district. Another thing that I thought would be helpful that you could relate to is Like Iowa, there's lots of rural areas in the Commonwealth of Pennsylvania. And so this is a rural school district who was examining their youth perception data. And what they found was that they had kids who were saying, I'm thinking about hurting myself, I'm depressed. By the way, this data is all pre-pandemic. That survey is completed still every couple of years. They actually did it just this fall. My kids came home and talked to me about some of the questions that they thought were interesting. And, I think it's important for us to wrap our arms around some really rich data. And so here you can see some of the data all the way back to 2015 for this district, but they saw an increased risk of suicide and mental health challenges, experiences with bullying, and worry about threats of violence, as well as increases in substance misuse. All right. And so what they did was created a plan using some of the strategies and recommendations that I've shared with you here today. And so that included things like adding in universal screening, selecting and installing a new SEL curriculum, building on their relationships with existing community mental health providers, and things like making sure families had enough food, increasing professional development around making sure there was positive contact with families and building relationships with kids. And so here is some of their data over time. You can see in the orange bar, that's their pre-intervention data, 2015 from their PAYS. 2019, after they put some of those interventions in place, because guess what? The data is not going to change overnight. It takes time. It's a process. But you can see in the last bar, the gray bar is the state average, that they were able to decrease by 22%. I see that's really small for you. This is the question prompt. At times, I feel no good at all. 22% less kids reported that. The next one, I felt sad or depressed most days, a 19% decrease there. And the third one, seriously considered attempting suicide, a 22% decrease. And so the work continues, but that is just one super quick example of how by using our system and our data, we can build a continuum of practices to prevent and intervene at the first sign of risk. It's 11:45. All right. Thank you. I'm happy to listen to some questions or talk with you for a few minutes. I appreciate your time and attention today. Enjoy the rest of the conference.